Our next presenter is Dr. Deborah Leveille. Dr. Leveille, I had the pleasure of working with her in, I believe it was 2020 for the September ResearchGate conference. Dr. Leveille was very instrumental in developing the program, having us receive our CEUs. And so that work gave us a really good starting point for that conference. So let me introduce Dr. Leveille. Dr. Leveille is a leader in nursing education. She serves as the National Nursing Curriculum Committee Chair for a 20-campus college system in the United States. She is an expert in curriculum development and active teaching learning strategies. She has successfully modified curriculums and implemented teaching learning strategies that have produced immediate improvement in student outcomes and faculty development and satisfaction. Please help me welcome Dr. Leveille.
Thank you, Donna. It's nice seeing you all, and I'm loving the presentations. I'm sorry I had my camera off. I have this is a high traffic area. I'm at work here, and I just locked my door. I hope nobody walks into it and hurts themselves. There's a glass door there, and they always just barge right in. So I do want to tell you a little bit more about myself. My mission, really, I work with failing programs because nursing is a calling, right? I mean, we always hear that, but a lot of people aren't getting the call because admission standards are too high. They don't have the opportunity. So whenever pass rates go down, programs want to increase their admission standards. And then that shuts out so much of the population. They don't have the opportunity to become a nurse. So I work with underserved populations. I'm working for a Christian based university here in California now. And they're all, our students are mostly Filipino. Our admission standards are very low. We cast a wide net. So I'm happy about that because there's so many diamonds in the rough. And you know, everybody should have an opportunity, and that's my mission. Let's see if I can get my thing up here. So I have a passion for nursing, but I also have a passion for education. And I think that education should be fun. You know, when we were little kids in elementary school, we're so excited to come home and tell our parents or anybody that we learned our colors or learned our alphabet. For some reason, it just seems like education just, the system just beats the fun right out of it. And it really should be discovery and excitement. One of my favorite quotes is from William Butler Yeats, and education is not the filling of a pail, but the lighting of a fire. And to get to that point, we need to change our system, how we teach, you know, healthcare, not just nursing, but anybody in healthcare. We have to get away from the linear model and start integrating, have an integrative curriculum structure. And so we're going to talk about that because everybody knows what a linear one is. That it's the traditional education system that most of us or all of us have gone through. So this is a linear, just focuses on you start a program. Each quarter, you gotta be successful in all your courses and you move forward. And it really just focuses on the student or the cohort. So you get that little click because you're in tight with your cohort. You all move forward. And it's very compartmentalized. And with this, there's a lot of silos. This type of program promotes pumping and dumping. They just want to get through this, and I don't care. I don't really need to know my A&P or my micro, and then they forget it. They go to their next courses, and they just focus on that, and then they forget that, and we don't revisit it enough. So when we get to the end of the program, and I know as nurse educators, if there's any nurse educators, I know that some of you are, we panic at the end of the program. We're like, oh my gosh, You know, the students, they haven't done this since fundamentals, and that was a year and a half ago. And then everybody tries to cram it all in at the very end, like we're just trying to stop the hemorrhage. And it shouldn't be like that. The linear, we just have to get away from it. It's not effective. And especially with populations that have gone to weak public school systems, they've never taken their SATs. They just never had the opportunity to get a good education. So they don't really know how to learn. So they struggle in this type of program. But if you have somebody who's a 4.0, they're going to make it through because they had a good base. So, but that's not the population that I work with. I work with the ones that struggle.
Dr. Leveille, sorry for interrupting you. Would you please go in the top there where it say display setting? If you can make it, if you click on the display setting in the top, it should be in the middle, right there. Yeah. Yes.
Oh.
And then you choose yeah, this one here is what?
This one?
Second.
Okay.
Yeah, here you go. We get it.
All right.
Perfect.
The big picture.
Thank you.
Sorry about that. So this is a linear curriculum. We're all familiar with it. You know, we're just moving through the program. We're pumping and dumping all the way through just to get through it. You know, it's like a chore. And not only are we promoting pumping and dumping, but we're making it seem like a chore. Like, oh, you've got to accomplish this, not making it exciting, engaging, and all that. And unfortunately, we teach in silos. So like I said, we don't revisit enough of what we need, those key concepts that we need to remember. They're not revisited enough in a linear curriculum. So we have gaps. We teach in silos. You learn it and you dump it. Then we have a huge gap. And then at the end, we're supposed to remember it all, but you know, it's too much of a gap. And there's little interaction. Like I said, it's very clicky, you know, your cohort, and that's about it. And like I just said, we have gaps, pumping and dumping, teaching in silos. I mean, nothing positive about this. It all promotes skill decay, decreased retention. So not a good way to go. I mean, everybody does it because that's the way it's always been done. An integrated curriculum, it looks really busy, but everybody gets to know everybody. So you have peer mentoring, which is essential. We're going to talk about, it's on the next slide. So these students, everything goes back and forth. So first of all, I'm going to show you a slide that all the content is aligned. So right now we have 3 courses. We have a critical care course going on, physical assessment and pharmacology, and a skill lab. All the content every single week is the same content. So right now we're doing CNS. So all of them. So in the skill lab, we have scenarios that focus on CNS medications, all the basics, physical assessment for central nervous system. So the people who are in the critical care, if they need to brush up on their skills and their knowledge, their base, that earlier base, they can come and assist in the lab. Or they can audit, because if they're not very good in their CNS medications, they can come sit in my pharmacology class. So everything's connected. And the students that are in pharmacology and physical assessment, they get to hear all this. They're just immersed in the information. So it makes it easier to understand and learn, and it's fun. And they get to know all the other cohorts. So it is really integrative. We don't let you forget your information. We prevent the pumping and dumping. So at each, as soon as they start getting into the nursing courses, we do competency checkpoint exams the very first day of class. And that's not to be mean or strict. It's where are they deficient? What do we need to talk about and reinforce? And do I need to send them into the patho class to sit through cardiac lectures, you know, that week, or wherever their deficiency is. So checkpoints, we're doing all the peer mentoring in the skill lab. All the content is aligned. So all these checkpoints, when they get to the end, they know it. We didn't let them forget anything. We didn't allow them to pump and dump. So that is the integrated curriculum. And you don't have to change. People say, oh gosh, this is, we can't do that. I hear that. This is the third program that I've done this to. And I had the 28 campuses that we were working. I had most of those integrated curriculum structure. It's not hard. And they go, oh, we can't because of accreditation. I didn't change any content. All I did was move stuff around and then retrain the faculty. So it's not hard to do. So here, this is what it looks like. This week, week 2, we did neuro. The first week we did the assessments, the competency test to see where the deficiencies were, so we can help them. It's not punitive. We just want them to learn. Next week, we're doing cardiovascular, so all the way across the board here in gerontology, critical care, pharm, physical assessment, and patho. All of us are going to be talking about cardio. Now, we have a pharmacy program and a medical school that we're starting. That content is going to be aligned, and we are going to be working together, all learning the same. 1 week we're learning cardiovascular. Our IPEs is going to be more engaging because we're all learning the same stuff. And this prevents pumping and dumping because they have so much opportunity. They're immersed in the information. Everybody, the buzzword this week is neuro all across the campus because that's all we're talking about. So whether you're in cohort 29 or 30 or 28, that you're learning neuro this week. These are some of the, I was in Montgomery. That was a 28 campus, one of the 28 campuses. They had a pass rate of 35%. They went up to 85%. And I think it was 80% of them demonstrated competency with 75 items, which is the minimum items on the NCLEX. And they were in such demand. I mean, they all had jobs before they graduated. We were locked out of almost all the facilities, and we got back into all of them. And that was just 1 year of the integrative curriculum. And in Boston, we went from 68% to 99%, and I had to do that quickly. That was over 1 quarter because they were going to close that campus down. And this is their peer mentoring in here. These are peer mentors with students. So this is a workshop that I do with my faculty, or I just do it nationally and internationally for anybody that is interested. So developing a course, everything has to be about the NCLEX. And people go, oh, you're teaching to the test. It's about being safe. The NCLEX is about being safe, and we want them to be safe practitioners. And the NCLEX is the blueprint that tells us this is what they need to know. So yes, I teach to the test. And we have to reinforce all the core concepts to the nursing activity rankings. And we're going to talk briefly about it because I know I don't have a lot of time. This is usually a 6-hour workshop that I do. So we're going to look at the nursing activity rankings, and we're going to look at the surveys that they send out and how the NCLEX is built, and look a little at the next gen, which is, we need a paradigm shift in nursing education. And now they've changed the testing, the NCLEX. But if we don't change how we teach, that's going to be a very difficult test to take if you're still using a linear, unless you have your admission standards are 4.0. So most teachers, they just go in, they do a PowerPoint, and it's a blanket. They go, oh, I'm talking about cardiac, so I'm going to do a cardiac, everything on cardiac, and I'm just going to teach as though they don't know anything, right? Well, maybe they do know, like, about congestive heart failure. So it's a blanket lecture. I don't like blanket lectures. You shouldn't just be using PowerPoints, and I'm going to show you how I use my PowerPoints. But they should have a game plan. So most people, they just go in with their PowerPoint and that's their game plan. So they lecture for 3 hours doing a PowerPoint. That's not a good idea. It's not fun for them, and it's not going to be fun for you, right? You get bored doing the same thing, just talking. I've been daydreaming about going grocery shopping and everything else right in the middle of a PowerPoint presentation. And they don't do enough formative assessments. Most programs that are failing don't do enough formative assessments. They just charge through, they get a syllabus, and they're going to teach the content, and they're going to just go ahead and give that summative assessment, whether they know it or not. So that's not good either. It's all about the student, right? We're nurses, and it's always about the patient. Well, when we're educators, it's always about the student. We're here to help them be successful. So we have to align all the content, and every exam and quiz needs to be cumulative. Most exams, I mean, they'll go chapters 1, 2, and 3, you're going to be tested on. That's for test 1. And now for test 2, we're going to do 4, 5, and 6. And that gives them permission to forget about what was in chapters 1, 2, and 3 until the end of the class, the end of the course, when they have to go back and revisit it. Everything's cumulative. If my first exam is going to be, content's going to be on my second, third, and fourth, everything's cumulative. And everything has to match with the nursing activity ranking. It has to be meaningful. We all only have so much brain space, especially in nursing and in medical fields. We have to be very picky about what we want them to fill their brain up with. We don't want to waste any space, right? So this is how we build the NCLEX. So they do the 2 surveys. They're sent one out now, and they've got the next gen going, but these were the most recent ones. The other ones should be coming out soon, 2017. So it's a knowledge survey and nursing activity practice, and they combine those to build the test. And our next gen is going to be in 2023. It was supposed to be in 2022, but COVID came along, and this is what it looks like. So these are the activity rankings, what's most important to least important. And these are the knowledge statements that go with our nursing activity rankings. So this is what we need to teach, right? Everybody knows about the client needs, and here's the pie and the management of care. But what is most important is what nursing activity rankings and what knowledge statements make up management of care. And that's 20% of the pie. So we absolutely have to make sure they understand that. And then you got to figure out what to teach. So I just, we were just talking about, it has to be linked to the NCLEX, linked to the nursing activity rankings and the knowledge statements. Don't teach the textbook. I have teachers, they go, oh my gosh, but there's like 1,000 pages that for this topic. And I'm like, I don't care. You don't teach the textbook. You're the nurse, you're the expert. You know what they need to know to be safe. And I teach everybody, all my faculty become expert item writers. We're working on next gen right now. It just amazes me how many they know about the NCLEX test plan, but they don't really know what they need to know about it. So you figure out what you need to know, and then I have farm here, but the other slides are going to be GI, and it's all about preventing harm. So everything's got to be linked. Everything that I teach in the classroom has to be linked to the nursing activity rankings and the NCLEX. Everything that's going to go on my exams is going to be linked. So here's the new next gen. They finally realized, nursing is crazy, that we have all this stuff going on. So this is the new model and the new items with this new model. And that's, we don't need that. These are the next gen items. And now this makes multiple choice look like baby items. I mean, it looks like elementary school. This here, you're going to have a scenario. Each one of these have a scenario. So the matrix multiple choice item, you have a scenario, and you have to decide, is this finding, has it improved? Has there been a change? So there's multiple answers, and you can get partial credit. Here, instead of just select, this one's kind of like a, yeah, that's just a select all. That's not a big one. This one is a drop down, so they obviously can't have fill in the blanks, but your drop down could be 10 different items. And here in this one with the scenario that you have to have three, you have to select 3 different items and each have about 10. And the same thing here, a lot of drop down. So I have a scenario going on, and then I have to figure out, is there something neurologic that I have to do? What intervention do I have to do for neuro or respiratory or cardiovascular? And again, they have multiple drop down items that you can choose. So a lot of critical thinking. And this one I love, the bow tie. So you have a scenario and then you have to figure out, is these symptoms of Bell's palsy? Is it hypoglycemia? Is it ischemic stroke? Or, what does this scenario tell me? Who I'm assessing this patient? And then I figure out this one, it says that it's hypoglycemia. So I put that there. And then I have to figure out, what am I going to do for this patient? I have to take 2 actions. And then what am I going to monitor after I do these 2 things? What am I going to monitor? So you can see that this is all critical thinking. I mean, it is, these are just some sample items that are all linked. This is a management of care, nursing activity ranking 30, collaborate with interprofessional healthcare members. Everything has to be linked. And the formative assessments, when I tell my faculty, like, you have to do, they go, what, I have to do a pop quiz like every day? I don't have time to do that. You can do Kahoot, you could do Heads Up. All you want to know is at the start of your lecture, did they come in prepared? And what are their deficiencies? What are their strengths? Because if I'm talking about endocrine and I do a little Kahoot and everybody seems to get the thyroid, but they don't really understand the pituitary gland, now I know I'm going to spend more time talking about the pituitary. It's not going to be a blanket lecture. It's going to be more focused on where their deficiencies are. So formative and then summative. And we never, if I'm doing formative assessments and it's endocrine and they're not getting it, don't forge forward and give them the summative. I always tell them that the syllabus is a guide. It's all about the student. We want to see if they're getting it or not. Not everybody's going to get it, but if most of them are, then we can do the summative. But, I see that so often that I'm like, how did everybody fail the test except for one person? I don't think that they got it. So learning should be fun. I tell my students this the very first day of class, and they always laugh at me like, oh my gosh, Dr. Leveille, that's silliness, but it should be exciting. Especially in nursing, because it's lifelong learning. So there's all different things that you can do for a toolbox for formative assessments, and I will share anything. I'll give you guys my email. And yes, I tell people, I don't want them trying to memorize a whole textbook. You tell them what they need to know. I want you to tell them exactly what they need to know, because then they're going to remember it. If I say, I want you to know this much, well, my hands are way far apart, or I want you to know this much, they're going to remember exactly what I want them to know. But if I give them 1,000 pages, they're barely going to remember anything. So yes, their problem is, how do I apply it? You need to show them what they need to know. It's the application that they have a problem with. So this is what one of my classes would look like, or one of my faculties. So before the class, they give the students this outline. This is what the class is going to look like. And it's all broken up, so it's fun. It doesn't get boring. Your students aren't going to be looking at the clock going, oh gosh, when is this going to be over? It's torture, because you always have them doing something. And it's really, we go over all the time. And don't just go over PowerPoint. So we always start out with some med calc after I do a Who Wants to Be a Nurse. So we have a problem here and we have a drug, and then they get to tell me about the drug. And I usually have the student come up and they type it all in while I'm walking around asking students, you know, to do these problems. And then I do a verbal quiz. I ask 10 questions and they have to write it down. And then in order to get all the points, I have to collect 3 pieces of paper with their name on it, because they have to raise their hand and answer something. So those are my open-ended questions that I might ask. Or I might just have a simple little NCLEX knowledge test quiz at the very beginning, very basic. And I love worksheets. So I give them this. This is a GI worksheet that I would give them. It's 1 page and they got to fill all these in, and it's very small blocks because I just want the essentials. We play heads up. You don't have to get fancy and buy the tool, the app. You can just use PowerPoint slides, a piece of paper. So you can see here, this girl is just holding a piece of paper over her head and everybody's trying to get her to say what it says on there. Password, that's always fun. So the person gets up in front of the class facing away from this, and students are yelling at them, trying to get them to say dumping syndrome. And if they don't get it in a minute, then they get a big buzzer. So that's always fun. And you can do these online too. So password, let's see. We play name that drug. And all these engaging things, these are all critical thinking. These are all going to get your students ready for next gen. They're going to ace it because they're already thinking, all right, this is all I know. What is it? And then I ask a follow-up question. What's the best action of the nurse? And we give them the answers. And then you can also do it with disorders. So I have somebody with black tarry stools, abdominal pain, an hour after eating. But this gets them, you can see how in class, I mean, we're not just going over slides, we're going through the material, we're applying the material all the way through. And then Kahoot, everybody loves Kahoot. If you don't have it, you got to get it because it's so fun. You know, and then this is what my lecture would look like for GI. I have a scenario. Bob goes through, you know, he has a bad couple of years here. He comes in, I think he's got a GI bleed or something. Very short videos, and then we're looking at his labs and he's reporting pain, and hopefully they can see that he's losing blood. What's going on with Bob? So not just the traditional, it's all critical thinking all the way through the class. Identify and intervene. This is a perfect thing for NCLEX in next gen. You walk into a patient's room and something's going on. What are you going to do? And these are all critical thinking. You know, I'm running out of time here. And then at the end of the class, review again, do another pop quiz. What did they learn? So you get something from the beginning. Did they learn anything from your class? Hopefully they did. And then do minute papers. I always say, don't wait for the midterm evals. When you get blindsided, students get the information at least the second week. And it's just 4 little questions. Build a toolbox. That's what we're working on right now. That's all aligned to the NCLEX. And these are the campuses that I brought. Integrative curriculum. It's fun and effective. That's it. I'm sorry if I went over.
No, you did fine. You did
Okay.
fine, Dr. Leveille.
All
Thank
right.
you very much for your presentation.